Welcome to today's press briefing. On stage, we have Dr. Zhang Chok-Kwan, Head of Communicable Disease Branch from Center for Health Protection, and Dr. Linda Yu, Chief Manager, Clinical Effectiveness and Technology Management, Hospital Authority. I give the floor to Dr. Zhang to give us an update of the cases. Now, as at last night, we had 70 additional confirmed cases. Case number 9799 to 9868. 38 male and 32 female, aged between 2 months and 83 years old. 20 were identified at temporary testing centers. 11 of them were in the mobile testing stations of Yamate. 7 cases are imported, 1 from Nepal, 3 arriving from Dubai, and the 3 are related, and 1 from Malaysia and 2 from Indonesia. They are foreign domestic helpers returning from Indonesia, and they were tested positive on the 12th day sample. Now, for the 63 loaded cases, 12 are yet to have found. 12 are known case sources, and 47 are linked. And among the 63 local cases, about 31 live in Yau Chi Mong. 14 of them live in the Jordan specified area subject to compulsory testing, including 1 in the core area of the specified area. For buildings, we have 3 buildings with 2 or more units infected, and they have to be subject to compulsory testing. The first being Tek Yam Lao of On Yam Estate. There are 3 units affected. Previously, there was already a unit with a known with a very obvious source. And for these 3 units, they are not linked. So there are 2 or more units with unlinked cases. Tek Yam Lao has got 3 units with cases. All 3 units are on different floors and with different orientation. One has got 3 cases, another one with 1, another unit with 3 cases. Another building subject to mandatory testing is Laguna City Block 5. 2 units of different orientations and on different floors. One has got 4 cases, and the other one confirmed case. The third building is Prosperous Garden Block 2 in Mongkok. Again, 3 units are infected. Previous 2 units have known sources, but the third one is not. So among the 3, 2 are of the same orientation, and the third is not, and on a different floor. There are 5 cases. 1 unit has got 1, another one has got 3, and the third unit has got 1 case. That was in Charming. And in the Yamate specified area, there is also a building subject to mandatory testing. Number 121 of Wushong Street, there is 1 unit with 1 case. And also Ferry Street, number 7 to 10, 1 case. We have a preliminary positive case that involves a resident in an elderly care home in Khao Shang On building of a Battery Street in Jordan on the first floor. It is a small elderly home, and then the residents have been tested, and they've identified this case with no symptom. The sample was collected yesterday. And the case is an 18-year-old man who is mobile, and he could walk around in the elderly home, and he did not wear a mask all the time. There are 21 residents living together with the case, and there are 6 staff members. They have been listed as close contacts, and they have been arranged to go to a quarantine center. That's all from me. Thank you. Dr. Yu, good afternoon. As at 9 a.m. in the past 24 hours, HA system has noted 94 reportable cases. In the past 24 hours, 1 patient passed away in the public hospital. So far, 163 patients have passed away in public hospitals. In the past 24 hours, another 39 confirmed patients were discharged. 8,903 confirmed and 1 probable cases have been discharged. There are now 95 patients receiving treatment in 24 public hospitals in AWE. 37 are in critical condition, 30 in serious condition, 629 stable condition. We've got 1,224 negative pressure wards, occupancy rate 64.1%, number of negative pressure wards 676, and the occupancy, the usage rate is 71.7%. I have a few things to report to you. In North District Hospital, it was announced yesterday that a nurse working in an isolation ward was confirmed. 4 nurses from the same hospital have been listed as close contacts. The hospital and the CHP have done contact tracing, and one nurse from Tuen Mun Hospital and Queen Elizabeth Hospital, respectively, are listed as close contacts. They have had meals with the confirmed nurse, and the nurse in QEH was tested preliminary positive yesterday, and the infection control team of QEH is now doing contact tracing. The colleague had no symptoms. She works in the general ward, and she was in appropriate PPE. She was never engaged in high-risk medical procedures, and no patients have been listed as close contact. However, on the 19th and the 20th, respectively, this colleague has had breakfast or meals together with other colleagues. 5 nurses and 1 clerical officer in QH are now listed as close contacts. For the medical and geriatric ward in Tuen Mun, 1 nurse is confirmed today because of a sore throat and coughing. She went to the staff clinic, and then after testing, she has been found positive. And this case is not linked to the one I just mentioned. This nurse went on leave on the 15th of January. She has no direct patient contact, and after contact tracing, no one has been listed as close contact. Lastly, in Princess Margaret Hospital, a nurse is now preliminary positive. Earlier on, she had a family member confirmed. On the 1st of January, she was listed as close contact, and then onset date was the 18th, and she had a deep throat saliva test and negative, and then on the 20th another test was performed on her and is preliminary positive. The hospital has done contact tracing according to the colleague on the 16th of January. When before she received a notice for quarantine, she had meal with a colleague. Although they were separated by partition, they did not talk together, but then the meal lasted for 30 minutes. So to play safe, the colleague has now been listed as a close contact. When working, she was in appropriate PPE. No patient has been listed as a close contact. May I remind colleagues once again that whether when you're at work or on leave, please refrain from sharing meals together. In particular, many cases are asymptomatic, so you may not know that you have already been infected. The Chinese New Year holidays are around the corner. I hope you can all be patient and refrain from social gatherings.
So before you pose your questions, please identify your media outlet. TVB, I'd like to ask, Dr. Chuang mentioned Battery Street, second floor, there's an 80-year-old male who was confirmed. He's mobile. But does that mean he cannot leave the elderly home? That means he was just active in the elderly home. So did he get infected from the communal facilities in the building? And the second question is, some experts say that in Yau-Ma-Tei, the non-mandatory areas, there is a rising trend of confirmed cases. So will you increase the scope of the mandatory testing in the near future? And lastly, there's a Nepalese who is uncomfortable, and he got tested negative twice, but was confirmed positive only after admission to hospital. Maybe it's because of the sampling and the symptoms occurred on different dates. So will you be reviewing the testing procedures? The elderly home case, I so far know that he did not leave the elderly home center. So when they conducted testing yesterday, we were waiting for all the results to arrive. But since he's already a confirmed case, so even if the other patients receive a negative result, they will still be quarantined, and we still have to identify the source of infection. The building, there was an affected unit previously, and if you include this confirmed case in the elderly home, if it's confirmed tomorrow, then the building will have 2 units and will fall under the category of mandatory testing. Regarding the government monitoring of Yau-Ma-Tei district, will other measures be implemented? We'll still have to wait and see. Now, your question about testing arrangements, I know that the experts will look into that as well. Next question. Hong Kong 01. I see there are 3 arrivals from the UK. Are they carrying the mutated virus? And do we have any new developments in this area? And how many preliminary confirmed cases do we have? How many of them are from Yau-Ma-Tei? And third, I want to ask, the elderly home. That district is close to Yau-Ma-Tei. Have you tried to identify the source of infection? The patient, do they have any chronic diseases? The 3 arrivals returned to Hong Kong from Dubai via Singapore. They are a family. Typically, these confirmed cases, our laboratory will conduct rapid testing to see if there are any mutated viruses. If so, they will conduct further investigation. And if there's a preliminary suspicion that it's a mutated virus, that is the South African variant, we will be notified. Typically, it takes 1 or 2 days. Now, we have not received any of these new cases. The elderly home, it's a preliminary positive case, so I don't have many details. I only know that the patient is mobile in the center. He did not leave the elderly home. We need further investigation. We now have 40 plus preliminary cases. Some 16 were identified in the temporary testing facilities, and 11 cases were from Yau-Ma-Tei testing center. Next question. Now TV. And Prosperous Garden, there are 2 units in the same orientation. So how many stories apart are they? And I also want to ask, there are 2 more buildings that require mandatory testing. So we have conducted testing for many days now. Do you expect further new cases? Is there a spread, an outbreak? And in Northern District, there was a nurse who was infected. Do you know the source? Was it within the hospital, and did you do environmental testing? That's all I have for now. Charming Garden, they are a few stories apart. So in the designated area, if there's one case, we'll inspect the whole building. We want to identify silent patients, and one person has symptoms, and they took part in the voluntary testing and were identified. Regarding Northern District Hospital, the epidemiological studies are being conducted. We are now helping our internal medicine colleagues conduct testing, and all negative so far. Regarding environmental samples, we took 69 samples and they're all negative. Next question. RTHK, 2 questions. I want to ask, Sangwon building, is it a mandatory tested building? Why do you need one more case to do mandatory testing? And previously, there were contractors that used the double track system. So Dr. Chuang, does this help for testing for mutant variations? And when HA conduct testing, will you use this methodology? I'll have to check one building. It seems that there are 2 buildings that come under the mandatory testing scope. The double track, as far as I understand, there's a rapid test, and if there's a positive in the rapid test, then the samples we can conduct PCR testing, the nucleic acid test. That's for positive cases. Now, for negative cases, you cannot rule out the possibilities. So if it's feasible, then it will help us identify potentially positive cases. Regarding the hospitals, we are looking into the efficacy of testing and whether it should be applied to patients or colleagues. Now, if the patients have symptoms, we want to rely on the nucleic acid testing, and if we need quick results or if we need screening, we will consider using this platform, but we're still conducting evaluation. Next question. Ming Pao, in the designated districts in Yaomate, previously there were 6 buildings where they had sewage that carried the virus. Now, previously we had to rely on voluntary testing. So far, how many people have conducted testing? Could there have been any missed cases? If you look at these 6 buildings, they are very close to Reclamation Street 20 to 26. So do they have an infection risk? Are the sewers at risk? And I want to know, how does the government how does it define designated places and areas? And I also want to follow up on the case number 9614. It's the patient has been to Kamhoi building. That's a building where the sewage contained the virus, and this male patient, what did he do in that building? Did he work there, or did he use the toilets there, and that's why we have detected the virus there?
I don't have the places 9814 has been to, and I don't know the reason why he was there, but usually the duration of stay would be longer and involving the use of the toilet before the sewage samples would be tested positive. The number of people that have been to voluntary testing, I don't have the figures with me. You can check with the Home Affairs Department. Speaker is off mic. The core area within Jordan, within the Jordan specified area, there should be a core area, and if one unit is positive, then the whole building will be subject to mandatory testing. And there is a core area among the specified area. All residents within the core area, regardless of whether there has been any confirmed cases, will have to be subject to mandatory testing. You have to check with the Food and Health Bureau. Perhaps the local people of the view that there are more subdivided units and the living conditions are cramped, and they might be worried that not all confirmed cases can be identified. Yes, can we have an English question?
English questions from THK English News. First, about the case at the elderly care home. How could the man be infected, and is it possible that he had catch the virus from other care home residents, or does he usually go back home and he kind of catch the virus there? And second, regarding the Yamate situation, and are authorities kind of concerned that the cases are kind of spreading beyond that mandatory testing zone? And is there a need to eventually test everyone in the whole district to kind of put a stop to the virus? Third question regarding the nurses who are still gathering and kind of got infected as a consequences. Are they setting kind of a bad example despite the HA's repeated appeal to ask them not to gather? Thank you.
The exact root of the source of infection of the elderly resident in the elderly care home is still being investigated. If he did not go out of the elderly home, it's possible that there are other residents or staff they are also infected and infected him. So this the exact source is still under investigating. For the designated zone is a more concentrated place where most of the cases, I mean a majority of cases are happening there. For those outside the zone, of course, there are other cases, but we are still, for if there are 2 cases in 2 units affected in one building, we'll put them under compulsory testing. So the government is closely monitoring the situation.
Well, indeed, the cases in the community is still fluctuating, and many of them are asymptomatic. And so we continuously appeal to our staff and also public to refrain from unmasked activities, especially social gathering or meal. And so Chinese New Year is coming, and we here want to appeal again for our staff and also the public to refrain from social gathering and reduce the time of unmasking activity.
下一條仲有冇英文問題？係嗰邊啊。
Any more?
From SCMP, I just want to ask for the 3 imported UK cases. Does it seem to be a loophole, because even though the flights were banned from the UK, but yet people can still fly back via layover through Dubai or Singapore? And also for the mobile testing, because a Nepalese family had a lot of false negatives, so could there be any issues with the mobile testing arrangements, and what will the government consider any changes in the future if there is any problems with mobile testing? Thank you.
I understand the 3 cases from Dubai to Hong Kong, they stay in Dubai for a month. Yeah, so it's not an imported case. Of course, we still need to check the city value, etc., to see whether they already got infected in UK. One of them has symptoms onset on 14th of January, and the other two, one had a symptom onset on 15th. So it is possible they acquired the infection in Dubai. Yeah. And I'm not familiar with the testing techniques and etc., but what I understand is that the sensitivity of the test depends on the testing site, the date of testing, whether you have symptoms the day before or after you have symptoms. So it all varies, and also the different collection sites, whether you collect diphtheral saliva, nasopharyngeal swab, combined nasal and throat swab. They also have different advantages and disadvantages.
下一條啊，呢邊中
This journalist in the middle. I am Apple Daily. Good afternoon. Regarding Shangon building, it was said that it was in the core area. So even though there is only one case, mandatory testing will apply. Can you please clarify? And case number 9459 is in Shangon area, is close to the elderly home. Are the cases related, and will you evacuate all residents before checking the sewers? And the Nepalese male who was tested false negative was in a serious condition. He had to use oxygen. I'd like to know the reason for that. Was it because of delay in admission to hospital? Because the mobile testing stations are being the responsibility of HA. So will you double check their reliability? And we're told that in some report there were 4 preliminary positive cases. I'd like to know whether they are not confirmed today, and how many false positive cases have you got? A question for the HA for Tuen Mun and QEH. I'd like to know the specialties they work in, and how have they been in contact with patients? Let me check. I do not have my record hasn't got a patient living in Shangon building. Perhaps I have to check. There is? What is the number? 9549. I have to check to see why it has not been included. It seems to be within the specified area. Speaker is off mic. Speaker is not speaking into a microphone. The elderly home is on the first floor, and the patient lives upstairs, and I'd like to know whether it's been included into the mandatory testing building list, or has it been missed? Yes, the Bureau is responsible for the mobile testing stations. The speaker was off mic. I'm not an expert in this. I think it's up to a certain degree of quality assurance.
The 4 cases in Samsui-ho, 3 are confirmed. They are from one family. They are from a specified building. One is not from Samsui-ho. He lives in Mongkok, in Charming Garden. They had walked to Samsui-ho. The Tuen Mun nurse works in the rehabilitation room, and the Queen Elizabeth nurse works in internal medicine. I don't have the last day they worked, whereas the Queen QE nurse worked, the last day of work was 20th of January. In the contact tracing, we have to collect a lot of data. I don't have the details. All I know is that these two patients' close contacts were only discovered at a later stage. I'd like to ask, on Yam Chun Dak Yam house, you said there are 3 confirmed cases, and one of the units was had a source. If the other unit did not have a source, then why were they not included in the mandatory testing? I also want to ask HA, the nurses confirmed today and the nurses confirmed yesterday, do you have the case numbers? And why were you so certain that the nurse from Tunmun was not related to the other cases and the nurse in Tunmun? Do you know where the infection source was? And since we have so many nurses being infected, does it have an impact on HA's service? On Yam Estate, the first case was on 5th of January, and the family were confirmed in the quarantine center. And the second unit case, the symptoms occurred on 14th of January, but they had a related case, so they had a source, and their relationship with the first case was a weak relationship. The third case, we have 9 and 15th, and the dates were 9th and 15th when they were confirmed, and they had a source. So we were not sure whether they were related to the first and second course. So it's a case with no unknown source. The nurse in Northern District, case number is 9854. The nurse in Tunmun is 9868. Now, looking at the 2 nurses in Tunmun Hospital, they did not work in the same room. The Tunmun Hospital confirmed nurse, we haven't found the source. There was no contact between the 2 nurses. So the Northern District Hospital and the Tunmun Hospital nurse, they were not related. If you're talking about the Tunmun nurse, where they had lunch with the Northern District nurse, and the last date of work was 20th of January. So we will keep an eye on manpower, we will make suitable deployment. So once again, we remind our colleagues to avoid having lunch together or having meals together to reduce the chances of infection. In Sangwon building, their mandatory testing was already conducted, and it was done between 17th and 18th of January. Cable TV, you said that the rapid test accuracy is quite high, but you said you'll rely on the nucleic acid testing. So why won't you include the rapid tests? Are there any difficulties, or what reasons are there for not including it? So people who have undergone rapid testing, will they have to wait for the rapid testing result before they're allowed to leave? And in the Yalmate district, we see Pitt Street between 15th to 27th. There were 6 cases yesterday, and 26 residents had been confirmed. So this building has a high risk. Is there any follow-up measures? Will you have to evacuate the residents in that building? And yesterday, in Yaojinmong district, there were more than 17 cases not from the designated, not from the specified area. So will you have measures for this district? Will you expand the scope of the designated, the specified area, or will you even have a curfew of sorts? Now we have We are monitoring the situation in Pitt Street. There are a number of infected cases coming from there. We've conducted one mandatory testing. So the new cases from yesterday were the family members of previous cases. So we'll have to keep an eye on the situation. These buildings are different from public housing estate, where we see vertical, horizontal corridors of infection. So we suspect there might be some environmental factors, such as the pipes and drains. And there are also subdivided units. So if we know there are subdivided units, then the whole subdivided unit will, the residents there will be sent to quarantine. Regarding rapid testing, I don't have the details. It might have to depend on the contractors whether they are able to do it. The nucleic acid test is more accurate. The rapid test, as far as I understand, the results are available quicker, and if we have preliminary positive, we can do the nucleic acid test to see if it's a positive case. But we don't have to we don't have to have a big load of cases. AM 730, the Samsoipo specified area, aside from those three, in today's new confirmed cases, you mentioned Charming Garden resident. So is that the new case in Block 2? You mentioned Laguna Garden has to conduct mandatory testing. Now, there was a security guard that was infected there. So is there any obvious or potential channels of infection between these cases? The old age home in Sangwon building, do they share the same exits? And were there any other residents in the elderly home that left the premises? Charming Garden, a new confirmed case, went to Samsoipo, so that's why they are confirmed today. Laguna City, previously we had the security guards being affected. Are they related? We'll have to investigate. Regarding the entrance points, I'm not sure. It's because it's a preliminary positive case. Dr. Chuang, I want to ask Shangwon building. There were 3 confirmed cases. 9549 was confirmed on 4th of January. There are 3 buildings there. So if we have another confirmed case tomorrow, it's already under mandatory testing. I missed that detail. It is one of the buildings that needs mandatory testing in Yamate. The sewers and pipes an issue? The building services department will have to look into it. These buildings, unless it's a very severe situation, if they have subdivided units, we'll have to look at it one by one. If we know there are subdivided units, then the whole unit, the residents in these subdivided units will be evacuated. Cable TV, you mentioned Yaojinmong district. There are more and more confirmed cases. Will you step up measures? Will you impose a curfew? The government will keep an eye on the situation. Okay, that concludes today's PC. Thank you.